So in the spirit of reconciliation, the ECCV acknowledges the traditional custodians of country throughout Australia and their connections to land, sea, and community. We pay our respects to their elders past and present and extend that respect to all Aboriginal and Torres Strait Islander peoples here today. Thanks, Shivani. Next slide. So now just a bit about ECCV. So the Ethnic Communities Council of Victoria was established in 1974. Since then, the ECCV remains the key advocate for culturally diverse communities. ECCV is a member-driven peak body, a voice of multicultural Victoria, and lobbies the state government on behalf of multicultural communities. ECCV's mission is to work to ensure it remains a driven peak body committed to empowering our multicultural community. Thanks, Shivani. Now just for some housekeeping rules. So if you could please keep yourself on mute if you're not speaking. At the end of the session, there'll also be some time for a Q&A, but if anyone has any questions throughout the session, feel free to pop them in the chat. Thanks. The Community Outreach Program. So in ECCV's Community Outreach Program, we are a team of bilingual outreach workers speaking in Punjabi, English, Turkish, Kurdish, Somali, Arabic, and English. Our aim is to reach multicultural communities to provide information in a timely manner, to promote the COVID-19 vaccination rollout and address vaccine hesitancy issues. Next slide, thanks. So the content of this presentation, I'm going to start by introducing our guest speakers, and then we will have, so at the start, we'll have Dr. Mohamed presenting and then some time for a Q&A. After that, we'll have Martin, who will come and present. And then following that, we will have Elizabeth from DLO. And at the end of all of that, we'll be able to have some time for a Q&A. Thanks, Shivani. So Dr. Mohamed is head of the Priority Community Engagement in the COVID-19 vaccination program. He is a microbiologist and a professional member of the Australian Society for Microbiology. He has also been an academic in the Department of Microbiology at Monash University for over 20 years. He is originally from Sri Lanka and has been the immediate past president of the Islamic Council of Victoria and is also the current deputy chair of the Faith Communities Council of Victoria. He is a recipient of the Order of Australia and is a current Justice of Peace. And now I want to invite Mohamed to come and present. Thank you.
Thanks, Rahel, and thank you very much for welcoming us. Again, I just like to reiterate that we will keep it, keeping it very in simple language because this is what we know. We are from the CAL community, so we are part and parcel of that. We understand the requirements of the CAL community. It's very diverse, so I think today's presentation is kept to that simple level of getting the message across. Feel free to ask any questions because that's what we are here for, to break down any myths and also break down any hesitation and build confidence in people wanting to get vaccinated as well. I also like to begin by acknowledging the traditional owners of the land we meet on and pay my respects to the elders, both past, present, and emerging. This land will always belong to the First Nations people, and we are thankful for their warm welcome to us as migrants. A lot of COVID cases, like we basically have thousands every day. We had a drop two days ago, but then we are going back to thousands. For people to understand what COVID is all about. So generally, most people who get COVID, it is a respiratory infection, like your common cold or your flu and all that. And most people will recover within about 2 weeks. But it can lead to complications, which is pneumonia is one of the most things that happens where there's building up of fluid in the lungs. And sometimes it can lead to more severe conditions, which needs oxygen, and then you might be on a ventilator. So if you need oxygen, you're going to end up in hospital. And then if you need to be on a ventilator, you might end up in the ICU as well. The virus also causes damage not only to the lungs, which is the key area where the infection occurs, but it also causes damage to other organs as well. And we also, as human beings, carry a lot of microorganisms in us. They are there to look after us, keep protected from other organisms. But sometimes when your immune system is down, they can cause secondary infections. Now, the way the virus is spread is from the droplets of saliva or discharge from the nose when you sneeze or cough. This is why it is said that when you sneeze or cough, please cover your nose or mouth so that you do not release the particles, the virus particles into the air, which can then cause infection in other people. Now, when a person gets infected, the incubation period where the virus is multiplying internally can take 2 to 14 days. And some people will not show any symptoms. They'll be asymptomatic during this period. So people might be infected going into the community, going into shopping centers, and thereby might be even unknowingly spreading the virus to other people. So if you have been to any site or there is various testings now in place, and it's very good to get tested if you have been to any site that is considered to be a hotspot. Just to give you, at the moment, this is the WHO's thing, over 258 million cases have been there of COVID since the beginning of COVID. Unfortunately and sadly, over 5.17 million people have died since the pandemic started. So there's been a big loss of life. So this is not like other diseases, other respiratory tract infections. This has caused a lot of problems in the human. Now, this is the latest stats for you to look at. So at the moment, according to WHO, 7.4 billion doses of the COVID vaccine has been given right across the world. There are over 21 different types of vaccines available across, and I'll talk to what is available in Australia. So the Australian standard is 91.8% of the first dose and 85.8% of the second dose. Victoria is standing on a higher level. We have got 93.1% of the first dose, and we have now passed the 90% with being fully vaccinated as well. But what I want you to look at is the number of cases nationally versus Victoria. Nationally, there are 18,496 active cases, the people who are currently having COVID. Compare that to Victoria, Victoria has 10,276. So we have more than 50% of all, or 60% of all the cases in the nation is in Victoria. So we, as people living in Victoria, need to be more vigilant, take more care when we are now having the freedom of moving in the community. Again, look at the number of cases in the ICU nationally, and compared to us, again, we are over 50%. So we are overrepresented. We have more cases than any other state in Australia at the moment. Sadly, look at the number of deaths. Nationally is 1,978. Victoria has had 1,306 deaths up to date since the beginning of this pandemic. And in this particular wave, since 1st of September, we have lost 486 people because of this particular infection. So it's important to understand the seriousness of this infection, and also to understand that we need to take care when we are out in the community. So today we are not talking of no COVID, we are talking of living with COVID. So this is the difference. Living with COVID compared to in the past waves, we said there's been no COVID, and we had few months where we didn't have a single case in Victoria. So today we are living with COVID. There are people in the community who have COVID. We are moving about with some of them. We might have them in our families. We might know friends who are having COVID. So we also need to understand that when you have a sore throat, a cough, a runny nose, or shortness of breath, or fever, it can be not just the flu, or it cannot be the normal cold. It could be COVID. So if you have any of these symptoms, it is important to get tested as soon as possible. What we have seen in this particular outbreak, wave of COVID, that many people delay getting tested. So they could be in the community for 4 or 5 days with COVID, spreading COVID to other people without getting tested. So it is important from day one, if you have been to a site, if you have got any symptoms, any of these symptoms, don't assume it's a cold or common cold or the flu. Get tested as soon as possible. Testing is free. You don't have to pay for testing, as well as vaccination is free. So what we are now talking about is not just vaccination alone. We are talking of people practicing COVID-safe behavior, because what we can achieve by COVID-safe behavior is prevention of the disease spreading to other people and also keeping your loved ones and your community safe. So wearing the mask in most cases, like when you go into any environment where you can't socially distance, please wear your mask. It helps you, as I said, because we can easily release the particle. Try keep your social distancing. Wash your hands using the hand sanitizers wherever you go, whether you be to a shopping complex or anywhere you go. Cough or sneeze into your elbow, or don't touch your eyes or nose when you're outside, because you never know whether it could be a person who is infected, could have touched a surface, you could have touched the surface. And one of the ways where we can get infected is through our eyes, nose, and mouth. So if you touch either of them, if a surface which has the virus, you could get infected. We must QR code wherever we go. It is compulsory now, and you'll find that most places will require that certificate of vaccination as well when you go to any place. So if you're not well, you stay at home. If you get tested, you stay at home. If you have symptoms of COVID and you have been identified as a positive person, you do not go out into the community. You remain at home. There is the period of quarantine, which has changed from the earlier stage of 14 days. I'll talk to you more about it now, but it is important that you get tested and stay at home until you got the clearance. There is some funding available through Centrelink when you get tested. If you are a person who is working on a day-to-day basis, you're depending on a daily wage, you can get support. There is short-term support for testing and waiting. There is and also there's support available for people who are staying the full quarantine period. So getting vaccinated is important, and following the health authorities' rules is important as well. So the term close contact. Who is a close contact? A close contact is a person who has come face to face or spent some time in a closed environment with a person who has COVID. Or you have been to a site where there's a big cluster, an outbreak, and it has been announced by the Department of Health on the website that this place has had COVID cases, and you have been to that place, then you could be considered to be a close contact. So they will be able to track you down by your QR coding and thereby ask you to get tested as soon as possible. So it could be close contact is a person living in the same house. If you have a person infected, then you are a close contact of that person who is infected as well. If you've been to a public exposure, or sometimes it be people who are working in a medical profession or working in a lab where you get samples from infected people coming in, and by accident, it has spilled on you, or you have been exposed to that specimen, and you can also get infected. Now, so there have been various changes to the rules. So if you have tested positive, you now have to quarantine for 10 days from the date of your first positive test. You also need to tell your family and friends you have been in contact with them and get them to test as well, whether it be your school, workplace, or you've been on site. So this is if you have turned out to be positive. So initially it was 14 days, now it's 10 days. If you live with someone who is positive, if you're fully vaccinated, then you only need to quarantine for 7 days on the date of the first positive case in the house. If you are not fully vaccinated, then you need to quarantine for 14 days from the date of the positive case in the household. You must get the PCR test, and normally the PCR test is done the day before you come out of quarantine. If you're quarantined for 7 days, then it's on day 6. If you're quarantined for the 14 days, it's on day 13 as well. So if you work work with or go to school with someone who is positive, you need to get the PCR test done within 24 hours of being told that you have been in contact with a positive test. You don't need to quarantine if your test is negative, but you need to wait in quarantine until your test results come. It is strongly recommended. There's a rapid antigen test for some places that they're now offering, so you can get that test. But the most accurate test is that you need to get the PCR test done to your workplace or to your school if you're going. If you are a social contact on someone who has tested positive, you might have contact. You should get the standard PCR test and get tested and then wait for the results. If you're positive, then you follow the process of quarantining. If you're negative, you can move back. You can just get about your normal day-to-day affairs. So when you are leaving quarantine, it will be done in the, as I said, the day before, the last day of the test has been done the day before you finish your quarantine, whether it be 6th day or the 13th day. You'll get a message from the department. Once you've done the test that you are now clear, you can get back to your normal routine. So today we have 3 vaccines which are used in the community. They're all very effective. You have AstraZeneca, which is referred to as Vaccinated internationally as well. It is the traditional vaccine that most of us are used to. We have had lots of vaccines given to us since we are babies, and this is where you use a strain that is done. Then we have 2 other vaccines that is also available in the community. They are the Pfizer vaccine and the Moderna. They are both mRNA vaccines. Again, the way the vaccines work, all 3 vaccines work, is when you're injected with the vaccine, it creates the spike proteins in you, and your body then produces the antibodies. You produce the antibodies, which then remains, the information remains in your memory, and then your memory is the one that will produce the antibodies if you do get an infection. Now, one thing to remember is that no vaccine can give you 100% immunity. All vaccines have a certain area. Sorry, I'll come back to that. So it's good to remember that no vaccine can give you 100%. So since the beginning of this pandemic in 2019, late 2019, the virus, a property of a virus, it undergoes changes. They call it mutations. The scientific term is variation or mutation, but in simple terms, it's a change. The virus undergoes change. But the change, when it happens in the virus, the new virus that is formed can become more infectious, can cause more problems than the original strain. So since the beginning, we have had over 11 different types of the virus undergoing changes. It happens in the human being, which is the host. So today we are dealing with the Delta strain. Everyone would have heard about the Delta strain. It is causing problems across the world. It infects people faster. Just even fleeting contact is enough for people to get infected. It is causing reinfection in some people. It is causing an increase in hospitalization, as we have seen. It is also causing infection in young people as well. So it is important to understand this virus is very virulent. It can spread fast. And those days in the beginning, you remember when somebody was infected, they could isolate in the home. The other people might not get infected. With today's virus, with this particular strain, if one person is infected in the home, most probably the whole family gets infected as well. So it is important for us to take care, follow COVID-safe practices as much as possible. The good news is we have all 3 vaccines that are available in Australia. They are very effective. What they do is, in most cases, they prevent you from getting ill, prevent you from getting seriously ill. Because we know with COVID, you can end up in hospital, you can end up in ICU, and it can also lead to death. Like we heard the day we had those 19 deaths a few days ago, we had a large number of deaths, the highest on a particular day. Out of the 19, 17 people were unvaccinated, people who died. So vaccination is a preventative measure. It's not a cure. It's not going to cure you if you have COVID. it is going to prevent you from getting infection or seriously getting infected. So what we have data available is after the first dose, you can build up to about 88% immunity. After the second dose, it builds up to about 90 to 98%. As I mentioned, there is no 100% guarantee that you will not get it and that no immunity can be provided. So even though you get vaccinated, you can get COVID, you can still pass COVID on to others, but it is not as severe as in an unvaccinated person. So apart from getting vaccinated, we also then take care to make sure we keep ourselves safe and our community safe by practicing COVID-safe behavior. So generally, when you get vaccines, any vaccines, sometimes you might have side effects, like you might have pain where you got the vaccination. You might have tiredness. Some people feel that. You might have headaches. You might have aches. Some people might have fever. So these are common side effects. Many people will have this. With Pfizer and Moderna, you generally see it after the second dose. With AstraZeneca, you might see it after the first dose. It can happen vice versa, but generally this is how the trend is. But some people might have none of these side effects. Like I'm a good example. I took the vaccine, I took AstraZeneca. I did not have any side effects. I know people who took Pfizer who did not have any side effects. So again, it depends on person to person. So if you do not have side effects, doesn't mean that the vaccine is not working. It is effective, but it is each person's immune system as well. Now, what I wanted to touch on was the anaphylaxis reaction, or which is called a severe allergic reaction. The best example I can give you is peanut butter. Some people are allergic to peanut. If they were to take peanut butter or anything with peanuts, they would immediately break out in hives or find difficult to breathe. So some people carry that EpiPen. People who have allergies carry an EpiPen where they can immediately inject them. So with this vaccine, sometimes very rare, some people might have this reaction to the vaccine. They'll find difficulty to breathe, swelling of their face, heartbeat. But this happens in the first 15 minutes of the vaccination. So this is why when you go to get vaccinated, you remain in the place under observation where the doctors and nurses are there for that 15 minutes. So if you do have a reaction, they can help you and treat you as soon as possible. We have not had anyone die due to this reaction, but it is where we can prevent this happening by giving you the immediate support that you require from the medical team. So you would have heard a lot about clotting due to AstraZeneca. There was a lot of information out there, a lot of fear being built up. Again, this is very rare. This clotting is very rare. Today we know how to identify the symptoms. So this generally occurs in the 4 to 30 days. It can be severe headache, where I mentioned that some people might have a headache in the 1 or 2 days, but sometimes this headache continues to go on beyond 3-4 days. That could be a problem. You could be having chest pain. You could see your leg swelling. You could have pain in your stomach, blood spots around the site of vaccination. So if you have any of these symptoms, you need to get to the hospital as soon as possible. They can treat you and they will help you recover from it. One thing to remember is you can get blood clots due to COVID. The chances of getting blood clots due to COVID itself, the infection itself, is 16.5% compared to chances of getting clots due to the vaccine, which is 0.004% or 1 or 2 in a million doses. So in Australia, we have given over 13 million doses of AstraZeneca. We have had 158 cases of this blood clot incidents. Sadly, in the initial stages, we lost about 8 people. We had 6 women and 2 men die. But today, in the last so many months, we have not had a single death occur in the community due to this vaccine and any blood clotting. With Pfizer and Moderna, we have another system that another side severe effect could occur, which is referred to as myocarditis, which is the inflammation of the heart muscle. The muscles that surround your heart get inflamed, and it then causes difficulty to breathe. Or we have pericarditis, which is the sac that surrounds the heart, again gets inflamed. So this can occur. We know the symptoms again, and we know that it can occur in the first 10 days of vaccination: chest pain, shortness of breath, irregular heart beating, pain with breathing, fainting. So again, if you have any symptoms like this, get to the hospital. They can treat you. There's not been a single case of death due to this incident. Now, what we also need to understand is myocarditis and pericarditis is also there commonly in people without vaccination as well. Generally in males, it can happen 37 per 100,000, or in females, 16 per 100,000. So it can occur in people. So it's not only due to the vaccine, it can occur. We also know sometimes due to the infection that you can also get myocarditis, that infection again. So there is possibility of people getting it due to infection, or it can be issue with individuals as well. So again, it is very rare. The vaccines are very effective. If you weigh the pros and cons of getting vaccinated against getting the infection, the vaccination is the best choice for everyone. Now, what we see is again that people do suffer with COVID, that sometimes people can have lots of long-term side effects after COVID. They have this, they have heart problems. Some people we know, I know young people who have had COVID who are still finding it difficult to do strenuous exercise. They find it difficult to breathe. If they walk too long, they're finding it difficult to breathe. So because we know the virus causes damage to the lung region as well. So it is important to understand that just getting COVID is not, and recovering is sometimes not an issue. Sometimes after COVID, some of the side effects can cause more problems. Some people will also have loss of taste and smell and might find it difficult to sleep after they recover. And some people who have been in the ICU or been on the ventilator will have depression and anxiety when they come out of the ICU and when they're back. So they might need long-term support going forward, and we are finding this as we move forward in the community. Now, we also know the vaccine is very effective and it can be given any stage during pregnancy. If people are planning to get pregnant, they can take the vaccine. There is no problem. There's lots of studies. There's a false information out there that women and men can become infertile or sterile due to the vaccine. There is no scientific evidence. There is no medical evidence to show any of this. It's a false rumor that has been created. And that's a different story. I can go into details, but it's a different story. But you can rest assured there's been no cases where people have suffered. If the issue is that they say when women get pregnant, their immune system drops. So they are more susceptible to getting infected with COVID. 5 times the chances of them ending up in hospital, sometimes also having premature birth, and sometimes the baby's health is compromised, might need, when they have the baby, end up in the ICU for the baby itself. So getting vaccinated for pregnant women is one of the positive things, and you can talk to your doctors. Please talk to your doctors and make the choice based on your doctors. They also find that the vaccine provides indirect protection to the baby through the placenta of the mother or through the breast milk as well. So people with special requirements, especially with disability, and their carers can get the COVID-19 vaccine. The boosters are now available to anyone 18 and over after their second dose of vaccine after 6 months. People with disability or special requirements, including people who use Auslan and people who have autism, can visit any vaccination site. They don't need to make a booking. They'll get their vaccination ASAP. They can do a walk-in and get vaccinated. So there's support available on the websites as well. And I'm sure you have a person who's going to talk to you about the support available with regard to people with disability. So there is all this. We have about 9 sites that offer special arrangements for people with disability so that they can enter those sites and get vaccinated as well. We also are now offering vaccination at home. People who have disability, who might have various disability, can be a mental issue sometimes because we have been in lockdown. Some people have that fear and anxiety to even move out of their homes. Some people will have physical disabilities. Some people have other disabilities which prevent them from going out of home. There is possibility you contact the Disability Liaison Officers. You can make arrangements, and the vaccination will be can be given at home. So there is the support systems available today. So these are some of the scripts. I'll share this slide so you can download the scripts and have a look. What if you have a disability and you go to get vaccinated at a GP, you're going to a state-run community center, or there's also possibility of getting vaccinated through a drive-in as well. So the advantages of getting vaccinated: it's effective, it stops the spreading of the virus, it helps you and prevents you from ending up in hospital or getting a. You need to get both doses to build up that 90%. The vaccine will not make you sick. It will not give you COVID at all. It does not carry the virus. So you will not get COVID from the vaccine. They have found that the vaccines helps people from not allowing the virus to mutate. Generally, any vaccine will take a few weeks before your immune system develops. It is not like a painkiller or an antibiotic which works within a day or within a few hours. Vaccines generally take a few weeks, and it takes about 2 to 3 weeks before you build up immunity. And this is why it's important for you to get vaccinated before you have somebody at home infected, or your neighbor or your friend having the infection. Get vaccinated as soon as possible. If you're already infected, the vaccine is not going to cause any, it's not going to reduce your infection. It's not going to increase your infection. As I mentioned, the vaccine is not a treatment, it's not a cure, it is a preventative measure. If you have had COVID, it is generally recommended that you wait for 6 months before you get vaccinated. But in today's context, because we are dealing with COVID in the community, it is recommended that 2 weeks after your recovery that you can get vaccinated as soon as possible. So today we know there are over 14 diseases we control by vaccinations. Whether it be polio, tetanus, measles, rubella, pneumococcal disease, and all that. So COVID vaccine is another vaccine that we will start working with as we go forward. So you are considered to be fully vaccinated if you have had both doses of the vaccine, or you have a medical exemption again for the vaccine, so that by an authorized medical practitioner, or you're under the age of 16. You can show the evidence of this, and I'll talk to you more about how so you can have this as how you show evidence of your vaccination. And if you are exempt from the vaccination, it is recommended that you have to get your doctor to upload that letter of exemption onto the Australian Immunisation Register, and then that is available on your MyGov website as well. You can't carry a letter from the doctor saying you have been exempt. That is not valid anymore. It was valid before the 12th of November. It changed. Now you must have the doctor to upload this information onto the website. Now, as I mentioned, for people who have had COVID, you can wait up to 6 months. You can get an exemption up to 6 months, but it is recommended that if possible, get vaccinated as soon as possible after you have recovered. So showing your vaccination certificate, so you might have your digital certificate, but people who do not have a Medicare or MyGov account, you can get your your certificate downloaded. Make sure it's the authentic certificate, and that can sometimes be used in certain venues as well. Now, the booster shots, the TGA approved the booster shots on 27th of October. It is now available since the 8th of November. It is available for anyone over 18 who has had the first 2 shots. Pfizer is the preferred vaccine that is being offered to everyone. But if you prefer to get AstraZeneca, you can get AstraZeneca as well. Or for some reason you have had a very severe reaction to Pfizer, then AstraZeneca would be the choice. As I mentioned, the booster shot is to build up your immunity. Generally, what happens is they have found international data that as time goes by, your memory, it's called waning memory, the memory to produce antibodies keeps dropping. So from 98%, it can drop to about 70, 80%. by having the booster shot, it lifts up and builds back that memory again to that high level that we normally had. TAGI has also announced some other aspects that it advised highest priority groups to get the booster shot. Those who have a high risk factor for severe COVID because they might be immunocompromised, as well as people might be working in areas that have a high occupational risk as well. So individuals age 50 and older, those who have underlying medical conditions, residents of aged care facilities and disability facilities, Aboriginal and Torres Strait Islander adults, these will help reduce the risk of severe COVID. People working in various areas like the frontline workers, it is suggested that they get their vaccination as well. So remember at the beginning, there was a rollout of different groups that were given vaccination. So many of these groups will now be eligible to get the booster shot. The government department is not going to send you a message to have the booster shot. You need to look at, you'll have your certificate, you'll have the idea of when you have had your second dose. So work that out, and if you can get your booster shot 6 months or later after that. Thank you very much. I'll stop sharing and I'm happy to take any questions.
Thank you, Mohamed. As mentioned, yeah, we now have a bit of time for a Q&A. So if anyone has any questions, please feel free.
Interpreter, you there? Can you hear me?
Yes, I can hear you.
I know it's a bit long, but can you just explain to the ladies the basic point about living with COVID and COVIDSafe, please, if there are no other questions?
Yeah. Hello. You mean the rules when you have COVID case?
What I'll do is I might put that slide up, then you can maybe explain it to them. Yeah, I'll put the slide. Just give me 2 seconds.
Idea.
Okay, that's good. Mm-hmm.
Sorry, let me get it up.
Yeah. Mm-hmm.
Sorry. Sorry. Sorry, give me 2 seconds. Yeah. Yep, done.
Yeah, get tested. Yeah. Dạ, xin chào quý cô. Khi mà bây giờ mình chỉ tóm tắt nói cái điểm chính đó, là khi mình có COVID á, thì mình cần đi test lúc nào ha? Khi bị đau cổ, bị ho, bị sổ mũi, bị khó thở, hay là bị hụt hơi á, hoặc là không có mùi vị giác với lại ngửi được ha, với ăn được, không thấy ăn ngon được đó, với lại cảm thấy lạnh, sốt ha, với đổ mồ hôi ha. Dạ. Rồi nhớ là COVIDSafe á, là bảo vệ cho chính mình và cho những người thân thương của mình với lại trong cộng đồng nữa ha. Cho nên là đeo khẩu trang, rồi giữ khoảng cách 1.5 mét, rồi rửa tay sạch sẽ, rồi dùng cái thuốc khử trùng ha, rồi ho với lại sổ mũi á, thì xoay nó vô trong cái nách á. Yeah. Rồi họ nói cái khỉu tay, nhưng mà mình thì mình nghĩ chui ấy vô trong cái nách á, thì an toàn là thấy dễ nhất. Dạ. Rồi đừng có dụi mắt mình với cái mũi với lại miệng. Rồi kiểm tra coi là mọi nơi mình đi á, mình nhớ là mình check in ha. Rồi mình ở nhà nếu mình không có được khỏe, với lại là giữ khoảng cách với mọi người chung quanh mình là isolate đó. Yeah. Rồi nhớ đi kiểm tra khi mình có những cái dấu hiệu và chờ khi mình có cái kết quả âm tính. Khi mà đi chích ngừa đó thì mình ráng có chích càng sớm càng tốt nha. Với lại là theo cái chỉ định của Bộ Sức Khỏe mà, hoặc là mấy cái trang website, rồi có mấy cái ca như thế nào đó thì mình theo dõi để mình biết tình hình chuyện gì xảy ra để mình thi hành mấy cái lệnh cho nó đúng ha. Yeah. That's all.
Okay, thanks you. Any other questions?
Mấy cô có câu hỏi gì không?
Arlene, I know you're English speaking. Any questions from you, Arlene? If you're still there, sorry.
I did actually see a question in the chat from earlier on in the presentation. So it was saying, it was from Miranda, does living with COVID apply to fully vaccinated as well?
Yes, because it applies to everyone, and you can see the difference of having fully vaccinated. Your quarantine period is different to a person who, in the same household, your quarantine period is different, and you don't need to quarantine like if you're not unvaccinated. And also, being vaccinated allows you to go about in community very easily. You can go into any place, because today I know I've gone everywhere I've gone. They've asked me for my vaccination certificate, so it's asked from every one of us. So it's living COVID, but that's the advantage, because they are also very strict. They're not allowing unvaccinated people into any of those establishments.
Okay. It seems there are no other questions. So
there was just one more in the chat from Sarab. Did you want me to read that out, or?
Yeah, I can read it out, Rahel. So, yeah, this morning on the ABC News, there was a lady who came up, a resident, and she was speaking about how her and her daughter needed to get a COVID test, and she ended up going to 4 sites and was pulled back, saying it was full capacity, and finally went to Monash Clayton and was able to get tested, waited 40 minutes, got her test. But my concern was, listening to that, was, you know, what do people with a disability with so many like accessibility needs and also carers, what do they do in, you know, what do they do in that regard, and what can the department offer for people with a disability and their carers in those situations? And a lot of things they're on the website, she said, but, you know, and she called up and they said, oh, we've told them to take it off, but it hasn't been taken off.
Thank you for the feedback. I think Lizzie might also give you more information, but I think you can ring that hotline and ask them to come and test at home. If she thinks she's at COVID and exposed to COVID, sometimes it might be better to get tested at home, especially if they have disability. Like with the vaccination as well, we are taking the vaccination to the houses to vaccinate people at home. So we are giving that support now. So Lizzie, you might be able to answer more.
Yes, thanks, Mohamed. And so just to introduce myself, I'm Lizzie Castles. So I coordinate the Disability Liaison Officer Coordinator program. So that's a long name. It's the DLO program. So I sit within the Department of Health, but there are about 35 now Disability Liaison Officers, or DLOs, that actually sit out in the individual health services. So as Mohamed mentioned, we absolutely help to organise vaccinations for people who have disabilities wherever they are and whatever their needs might be. We do our best to make sure we get a good fit for them. But in terms of testing, again, as Mohamed said, we can actually help to organise testing at home, which is called Call to Test. I guess it's worth noting with the Call to Test service, you can also request a specific type of testing. So, for example, if you know that actually the PCR test, so the test that goes up your nose and in your mouth, is going to be really difficult for someone, you know, due to their disability or due to sensitivities that they may have, you can also request or state that that will be difficult for them, and they can organise a saliva test or a spit test. There are a couple of different groups that are helping with the Call to Test, and they, of course, there's a couple of different names for the different sorts of tests. So I would always just describe what the person needs or what the person finds difficult, rather than saying I need a PCR versus a this versus a that. Just tell them that, you know, my son or my daughter or my mother or whoever it might be will have difficulty with the test going up their nose. So I need a test that I can spit on or lick, and people will understand what you mean. But it's also worth noting, if you're in touch with any disability organisations or particularly disability accommodation, and there is an outbreak, the department also has a service called the Outbreak, or the RREM Outbreak Service. I'll put their email address in the chat, and they can help if there's an outbreak for people with disabilities or in disability accommodation, and they again can help to organise testing and subsequent vaccinations if required. I hope that makes sense.
Lizzie, just a question. I know you mentioned an email address. Are there any phone numbers? And is the wider community, GPs and disability organisations, are they aware of this call to test service?
I really hope so, Julie. The information is available up on the department's website. So it is a phone number to access the call to test service. So it's open to anyone in the community who may need it. Again, in a second, I'll pop the link to that call to test site in the chat. So it's available to anyone. I believe GPs throughout the last 2 years really, the department has worked really closely with the GP networks and the PHNs, which are the primary health networks. So they're sort of the groups that do lots of talking and liaising with the GPs. They're all aware of this service. But so they could help to make a referral through to this service as well if required. But absolutely, you can ring up to make a referral, or if ringing is difficult for you, you can contact us and we can help to see what we can to make a referral on your behalf. But I'll pop those links in the chat. Excuse me.
So can you just quickly, I know we're probably running out of time, can you just quickly translate the call to test service? Some people may have trouble
that's right,
getting out of home.
Yeah, so will we have the number on the chat, the call to test? Mấy cô này ở đây bây giờ có cái dịch vụ gọi là call to test đó, mình có thể gọi người ta tới nhà để mà kiểm tra làm cái test cho mình ha. Thì cô sẽ để cái thông tin ở trên đây, mình có hỏi cái số điện thoại đó. Thì khi mà người ta tới nhà test mình đó, mình có thể yêu cầu họ có thể làm cái loại test khác nhau cho mình. Nhưng mà thay vì mình nói mình yêu cầu cái loại test tôi muốn có PCR, tôi muốn có cái loại này loại kia, mình đừng có nói vậy, mình chỉ nói là cái khó khăn của mình hoặc là người thân của mình là cái gì, rồi cái người chuyên viên này họ sẽ cho mình cái test phù hợp. Chẳng hạn như mình nói con tôi hay là tôi bị khó khăn đi vô lỗ mũi không có được, chịu không có được, thì người ta sẽ tự kiếm cho mình một cái test mà phù hợp cho mình ha. Nói chung là vậy.
Rồi, ok, cho cô Diệu ơi, cho hỏi thăm chút xíu, tại vì chích ngừa xong hết rồi. Sorry nha, chích ngừa xong hết rồi nhưng mà có Covid, nhưng mà bây giờ nó hết rồi, nhưng mà mình đi ra ngoài có bị ảnh hưởng gì không? Câu hỏi của mình.
Yeah, okay. So for someone who fully vaccinated but contracted a virus and got over the virus, but now if I go out into the community, what will be the effect? Maybe she means for herself and the community. So vaccinated, got COVID, got over the COVID, what now?
So if she got vaccinated, she got COVID, she's fine. And if she has got clearance from the test, she has done the test, the PCR test, and the Department of Health has given her a clear bill, she can go into the community. She's fine. She's not going to infect anyone. The infectious period is in the first 5 to 6 days, not at the latter stage. So the body starts producing the antibodies as well. So she's fine to go into the community. She should be okay.
Dạ, khi mà mình đã có cái PCR test á, mà nó về mà mình kiểm tra rồi hoặc là được cho báo trước là mình không có còn COVID nữa đó, thì là mình không có gây COVID cho người khác ha. Cho nên là nó an toàn để đi ra ngoài.
Tại vì mình muốn biết là nó có bị ảnh hưởng cho những người khác hay là không, vậy thôi.
I just want to know if it affects other people in the community.
If she's clear, she's been cleared after she's done the she's done the test at the end of period of infection because she has to get clearance from the Department of Health. So she'll get a message, an SMS saying now she's clear, that then she's free to go into the community. She's not going to cause it. But she's cured. She's like, there are a lot of people out in the community who have had COVID, who are totally gone back. They're okay and they're back in the community.
Dạ. Nếu mà kiểm tra lại mà có dương tính, âm tính rồi thì không có sao ha. Dạ, mà an toàn đi ra.
Kiểm tra xong rồi ở trên là nó nói mình can go to work đó, thì this one clear rồi phải không? Mình muốn biết gì thôi.
Dạ. So it's clear and it said can go to work. So it's all safe.
Yeah, if she's got clearance, as long as she's got from the department the message saying she's clear, then she can go back. If she has not done the test, and she has to get the test done. She can't go out thinking that she's cured. She must get the test done, and she must get the clearance from the Department of Health.
Không những mà có kết quả âm tính không, nhưng mà Bộ Y tế phải có cái tin nhắn từ Bộ Y tế, không phải tin nhắn, qua tin nhắn hoặc là một cách nào đó khác cũng được, mà Bộ Y tế phải cho biết là cô được đi ra khỏi cộng đồng ha.
Dạ. Cô em có một câu hỏi này chị Diệu. Dịch chậm ha, tại vì trong cái thời Covid đó, thì họ nói là chích ngừa trẻ em là từ 16 tuổi trở xuống là không có cần phải chích ngừa. Các anh đi bơi đi ha. Bây giờ ở luật nó nói là bây giờ con nít đó, dưới trên 12 tuổi gì đó là phải chích ngừa, còn không được đi bơi. Mà đối với em, chính phủ cho thì phải cho người ta một cái thời gian. Chứ bây giờ bữa nay thứ 5 ra luật, thứ 7 nó đi bơi, không có đi bơi thì em thấy chính phủ ra cái luật đó là không có đúng. Với lại nhiều khi á, một cái thuốc Covid mới ra, nhiều cái parent nó worry là is it good enough for kids, so họ dành thời gian để họ kiểm tra. Nhưng mà nếu mà luật nó đây vậy thì luật của chính phủ phải cho người ta thời gian. Ví dụ bây giờ nói là cái luật mới là như vậy, nhưng mà phải cho ta là trong cái đó là khoảng 2 tháng là bắt buộc phải chích ngừa thì ok. Giờ luật thứ 7 đi bơi cấm, trong khi nó Covid nó đã lockdown bao nhiêu tháng, bây giờ không cho nó đi bơi nữa thì em thấy cái luật nó không có đúng.
Yeah. I have a case like this, and I feel I will interpret the scenario first. Say before children under 16 can be unvaccinated and say we can go to swim and can go outside, but now people over 12 must be vaccinated, so you can't go to swimming, for example. But the law came out on Thursday and it's effective immediately or a few days later. So on Saturday, you have a swim lesson, you can't go. So I feel, and also if parents have some concern about the safety of the vaccines, I feel we should give some more time to think about it, rather than firstly only a few days and you can't go swim or you can't do your activities. I think that's unfair or not correct in my view. I think parents should give more times, say for 2 months or some time to think about if they have concern about the risk or the safety, or give them time to rearrange the activities or something like that. Yeah.
Thank you for the feedback on that. But just for, I think, information, you understand that children 12 and above, the vaccination was available quite some time ago. It is not new. It's not started recently. Children have been vaccinated for some time from 12 and above. So there's been encouragement to get children 12 and above vaccinated. We have done over 70 schools, or we have vaccinated quite a large number of kids in schools as well. So it has been in process, and we encourage parents to get their children vaccinated. The vaccines have been found to be effective. Going forward from January, we might be looking at children 5 to 11 also to be vaccinated. So I think the reason that parents, on the other side, parents who are vaccinated are very fearful that their kids could get infected by unvaccinated children as well. So it's a balancing act. We'll take this information back to the department and to the government, but the ability to get vaccinated was available quite some time for children 12 and above. So it's not new. It was not introduced recently. It's been there for some time.
And Mohamed, if I may,
Yep.
if anyone has any concerns about getting there at the moment, 12-year-old up vaccinated, so you think they might need a quieter environment, or you think they might need a different approach, or they might need mild sedation, or perhaps getting vaccinated at home is going to be the best approach for them, please reach out to my team, because that's exactly what we do.
Yep.
We really work hard to make sure we get the most appropriate vaccination option for a particular individual. And we've helped, it's getting up to about 8,000 now Victorians with disabilities to get vaccinated in a variety of different ways. And again, we're available across the state, and we do, link in with GPs, with vaccination hubs, with pharmacists, with InReach. So, there's a lot of different options that we can look at to make sure that we're going to do something that's going to work for your little one. We're very mindful of particularly the autistic population, who have a lot of needs in terms of a low sensory environment. And we've got some excellent clinics that are set up specifically to support this group. But also, as I said, we can do in-home vaccination if needed. And we know that can be a great option, because mum and dad, or, a parent or a caregiver can be there to provide support. So if you've got any concerns, please get in touch, and I'll put our referral details again in the chat.
And I just wanted to mention, oh, sorry, Hayat, you had your hand up. You go, and then I'll speak.
Okay, yeah, can I just interpret that first?
Can I speak, or she's still going?
I think we just
Can
need
I
to
just
translate.
quickly interpret? Yeah. Vì thì anh Mohamed, anh nói là cái thông tin mà trên 12 tuổi chích ngừa thì cũng đưa ra khá lâu rồi, cũng khuyên phụ huynh con nên cho con mình chích ngừa, và những người phụ huynh khác cũng sợ con người ta chích ngừa bị lây bệnh đó, thành ra là cũng người ta cũng cân nhắc, khi mà người ta đưa ra quyết định thì ta cũng cân nhắc đôi bên vậy đó. Rồi cô Lý Dì là cô nói là của trong trung tâm của cổ đó, nếu mà cũng có những em nào mà về quan ngại hay là cần những cái nơi an toàn hơn, yên lặng hơn để chích ngừa, hoặc là cháu thấy chích ngừa ở nhà thấy thoải mái hơn, thì cái dịch vụ này cũng có thể đến nhà để giúp gia đình với mấy cháu chích ngừa ha. Rồi họ cũng có kết nối với GP, rồi chỗ pharmacy đồ nữa, cho nên là họ có rất là nhiều cái sự kết nối với lại cái dịch vụ, thì cứ liên lạc với họ, rồi họ sẽ có một cái cách nào đó phù hợp cho gia đình với lại hoàn cảnh của mỗi em ha. Thì thông tin ở trong cái chat này thì chắc cô Julie sẽ giữ lại rồi đưa cho mình ha. Yeah. So Julie, I trust you will share the call to test information with us later.
I will.
Yeah. Okay. Rồi cô Julie giữ hết rồi, cô sẽ đưa cho mình ha. Yeah. I guess I've finished.
So we're going to finish this session earlier than usual. So I'll just send them another link so we can have a chat after this session.
Yeah, so we have a couple of minutes left until we need to move on to the next part. But Hayat, I think you had a question, and then Sarab, and then I think we need to wrap it up. Oh.
Okay, thank you very much. First, I would like to thank Mohamed and Lizzie for very informative information. And I have a comment and a question. The first comment to Mohamed, I know you mentioned earlier that there are sometimes people take longer time to get tested. There is also another reason, and I'm speaking from my experience of what happened with other people. Last Thursday, I was in some place, and on Monday, I received a phone call saying that someone was there, they tested positive, and we need to get tested. So Friday, Saturday, Sunday, weekend, you don't know how many people I've been in touch with. Imagine if I tested positive. We can't always blame the community. Everyone is responsible. Sometimes like mistakes happen, I understand, but not only the community. People in higher places, they always make mistakes.
Thank you for the feedback, and we do acknowledge that sometimes it has been a little slow in the contacting people, and we will try and get it as fast as possible going forward, I think. Yeah.
Yep. Thank you very much for acknowledging this. First question, if a family or someone has corona, and when can we, like after they are tested negative, they're cured, what is the best time to meet with them? How much time do we leave? Or where can we meet with this person who had corona?
So if they've had COVID and they've recovered and they've got a clear bill of health, and they've done the second test and they're all clear, once that is done, they are out in the community, you can meet them anytime.
Okay, thank you. The second and most important question for kids with disability. I have a grandchild with cerebral palsy and cannot get vaccinated. What can we do for protection? You know, like living safely with COVID, and what are the measures we can take to protect him more? Like we need to do more than with other kids who are vaccinated. What do you recommend?
My recommendation is that there are going to be people who cannot get vaccinated. We know there's a lot of exemptions as well due to various reasons. It is, I think, the rest of the family taking as much precaution as possible to support and keep the person from getting infected. Like I had a person who had cancer with me who was immunocompromised. I made sure that whoever came to the house was, fully vaccinated. If they had any cold or cough, never came to the house, never, I did all I could to protect the person as much as possible. So I think as family and friends, I think we have a responsibility to look after this child and make sure we can protect them as much as possible, I think. Yeah.
So can we still send them to school? Because I know some families with kids with this problem, they don't send us, they stop sending them to school.
I think we'll have to get a doctor's view on this, because again, in schools, you can I was just looking at the numbers of cases in many of the schools as well. There's been outbreaks. So you'll have to get the doctor's opinion on this, because the doctor who is treating might be the best person to make that decision and give the advice to the family and the parents. Yeah.
Okay, thank you very much.
And Mohamed, if I may, I would always say that if someone is or believes that they're unable to be vaccinated, that they always seek medical opinion, and they work really closely with their GP. There is a service which the GP can refer the person to. So just, for example, they've had an allergic reaction in the past, or they think, that they might be allergic to the vaccination for whatever reason. I would strongly recommend that your GP makes a referral to the VicCIS service, because they are the absolute experts in who can and can't have a vaccination and who may or may not have a reaction. I know there has been some thinking that particular groups can't, or people with particular disabilities cannot have a vaccination. That's not true. It's very much up to their individual. So I'd always double check and do everything you can to look at how the person can get vaccinated from a is it safe for them to get the vaccination perspective, but then also what can we do to make sure that vaccination is successful for them. So I'd always because it is the best thing we can do to protect them. Yeah, thank you.
Any other questions?
I think we just need to move on to the next part of this presentation. So we have Martin here who's going to quickly chat with us. So he's the vaccination community champion, and he's going to share his story of vaccination. So Martin has a BA and an MA in English Literature from Cambridge University and an MA in Communications from RMIT University. A road accident in 2010 left him quadriplegic. For the last 3 years, he has served as chair of the Board of Ideas, a New South Wales-based non-profit providing information to and advocacy services for the disability communities throughout Australia. He was appointed to the Victorian Disability Advisory Council in October 2019. He is also a founding member and on the steering committee of the Melbourne-based Spinal Cord Injury Network of Professionals. So now I would like to invite Martin to quickly chat with us. And after, there'll also be time for some questions for Martin as well.
Thank you very much indeed, Raha. Yes, I have a disability. I broke my neck 11 years ago and 11 years and 3 days ago, actually, just had my anniversary. And yes, I'd just like to reiterate, I think what Lizzie was saying about different groups of people with disability who may or may not be able to take vaccines. I think it's really, really important for anybody with a disability to make sure with their medical professional, with their GP or their consultant or whoever is there, whoever knows them best, whether they in particular are eligible or are able to get the vaccine. And don't make assumptions just because you have a certain condition that you can't be vaccinated. It's really important to get that medical advice from somebody who knows your condition very well, and preferably your treating GP or treating specialist. It's really, really important. I was really happy to get my vaccine. I was very lucky that my GP was one of the clinics that did offer. So I went to my GP, who I've been to for several years, and it was very easy. I had to make a booking, of course, but it was great to have somebody who I knew who could administer the vaccine for me, and I got it done as early as I could. I think Mohamed was saying earlier. I agree entirely that it's really a responsibility all of us have to be vaccinated, to protect not only ourselves but our family and friends and all the people we come into contact with, as well as the broader community. And one of the points I'd like to make is that as a person with disability, I'm much more likely to be mixing with other people with disability who may well be immunocompromised, and I think it's more important for people with disability to get vaccinated because we're more likely to come into contact with other people with disability who are more vulnerable and more likely to get sicker if they get COVID. So I think it's even more important for us. And I think the other thing is we're finding, of course, that with the new rules that have been introduced, there are limits on where you can go if you're not vaccinated, and sadly, people in the disability communities are more likely to be socially isolated anyway, just as a matter of course, for whatever reason, for numerous reasons. And if we don't get vaccinated, then we're going to be even more socially isolated than we usually are, because we won't be allowed to go to the cinema or to go out to eat in cafes or to meet our friends in lots and lots of places. And also won't be able to go to certain shops. It's really going to, if we don't get vaccinated as a person with disability, it's really going to increase our isolation and our separation from the rest of the community. So for that kind of selfish reason, if you like, just to have more, to make sure that we can mix with everybody else in the community, just be like everybody else in the community. And it's a very simple thing to do, is to have a shot in the arm. Now, there's a lot of work being done, I know, by the Department of Health on making some information available for people with disability. And I think Lizzie put something in the chat in the chat, and on that page there's so much information, there's so much stuff there that's going to help, no matter what kind of disability you have, whether it's information about more accessible clinics or vaccine centres. And I think there are 8 or 9 of those, and then different pop-up centres. But I think, one of the great initiatives that the Victorian government has come up with is to establish this system of disability liaison officers. Now, I would really encourage everybody just to get in touch with a disability liaison officer and get some really sound and clear advice about what's your best option to get vaccinated. And they will help you to decide what's best for you and for your family and for your loved ones, whether it's assistance to get to a particular vaccination hub, or to go to a particular vaccination hub, or whether you're eligible or able to get someone to come to your home to get vaccinated. There are so many different options that are available to you, and I think my biggest my strongest advice is to actually talk to a disability liaison officer who has all the information at their fingertips, who can really help you to choose the most suitable option for you. I don't know if there's any questions. All I can say is that I would visit the page at that link, and there's all sorts of stuff on there that's going to help you.
So are there any specific questions for Martin or comments? Feel free to raise your hand or pop something in the chat. There's also a few more questions for the Department of Health that we could cover as well quickly before moving on to the next section of the presentation. Okay. So there was a question put in the chat that Suzanne, I don't know if you wanted to.
Yeah, I would like to introduce Fahriye, because yesterday I spoke to her about our today's session, to invite her, because she works with students and at Clory Primary School. I don't really remember the school name. And then she's got a very important question. If you have time for that, I would like to invite her to ask that question to Mohamed or either Lizzie. Thank you, Fahriye. Thank you, Rahel. Thank you.
It's just a very difficult situation that I have a family they're experiencing. She doesn't even have the diagnosis for her illness yet. She is going back and forth to the hospital, and it's a rare muscular disease that doesn't have a name. And anyway, between her specialist at the hospital and her GP, they're not recommending she have the vaccination. And she's agreeing with them at the moment. However, they're not providing an exemption letter, which is making life really difficult for her. And so for this reason, she's almost come to a stage where she doesn't want to listen to the doctors and just go and get the vaccination so that she can take her children out and about. I mean, she's not allowed to enter our school until she's double vaccinated. So that's a very difficult, challenging time for her. She can't engage with the school because of this reason. And I'm sure many other things too in her life. But today, when I asked her to come along to this, she said she actually had another meeting with the doctors, and they were going to provide a little bit more information regarding vaccination or an exemption letter. So if it were the situation that she couldn't get one, what does this poor woman do?
Mohamed, do you want me to? I'll start in responding by saying thank you for sharing that case study, my heart goes out to the lady. It sounds like not only is she in a position where she's struggling with to find out what's going on with her from a diagnostic perspective, but she's also having these barriers placed on her, and that sounds like a really tricky situation. I think it's worth going back to my earlier comments about if you're ever not sure about if you should or if you shouldn't, to get your GP to make a referral through to the VICSIS system, because they're, again, the absolute authority on yes, you can or no, you can't have a vaccination based on a particular diagnosis or medical condition. So that would be my first recommendation. To be open with you, this is the second instance of this occurring that I've heard of this morning. So I'm going to raise this with the department to make sure that there are certain processes in place for those who are in the process of getting clarification about whether or not they can or they can't, and thinking about what exemption, temporary exemption even, might be able to be provided whilst they're going through an assessment process, I suppose. So we speak quite regularly with the VicSys team, who are the yes or no on the safety of the vaccinations for individuals team. So I would recommend that you send the referral information through to us, and we'll see what we can do to support and escalate that through VicSys. But the number one recommendation is absolutely for the GP, they can't say on one hand, no, you can't have it, but then refuse to provide an exemption. That makes absolutely no sense at all. So I'd be really seeking a referral to the appropriate service who has, the knowledge, the depth of knowledge and the experience to make an informed decision about her ability to receive the vaccination.
And I'm so sorry, I missed the beginning of the presentation. So where is the place that she appealed to or connect with?
Yeah, so the service is called VicSys, and her GP can make a referral to the VicSys service. If the GP doesn't, and the GP will know all about it, it's been very heavily promoted through their GP networks. If the GP then, for some reason, doesn't agree to do that, let us know and we'll see what we can do from our end. But it's, that these services are absolutely set up for the non-straightforward options. And, as I said, my heart goes out to the lady because it sounds like a really tricky situation that she's in.
Thank you very much.
I just posted the link to VicSys on the site.
Did you have anything else you wanted to add to that, Mohamed? Or?
I think Liz has given all the details. I think it's just a matter of following up, I think, and taking this matter. And I think looking at other systems to support this lady.
Yeah, thank you. I've just got that the link. Thank you.
There was also one more question put in the chat by Sarap around digital literacy and support that can be provided.
I think with digital literacy, I think it's working with the communities. I think that this is the support the communities are offering each other, like their own groups. I think that because it can be a smaller group of elderly people, or it can be a group of new immigrants, new migrants as well. So I think it works differently. I think building up that literacy rate and helping them. So I think that's how the organizations work with. We have funded a whole lot of organizations. We have funded lots of local government associations, local governments as well, to help with the digital literacy as well. So it's supported.
If I quickly add here, Sarah, from our end, we are also doing presentations in space of COVIDSafe plan, COVIDSafe planning to help community to stay safe when we are opening now. And at the same time, we do some presentations from our end ourselves about COVID vaccines rollout and who to contact if you have any hesitancies. And in that presentations, we are just introducing COVID Victoria, what with the app, Service Victoria app, and how we can attach our COVID certificate to that. So we are just going step by step all the information, and we are showing videos as well to the community through our presentations.
Shivani, so if the people that are attending here, they want to attend one of those workshops, how will they just go on ECCV's website and inquire through there?
Yes, and
yeah,
if you want us to hold any workshop for any groups, you can contact us, or we will keep update you for any upcoming workshops. Thank you.
Okay, great. Does anyone have any more questions for Martin, or I'm happy to move on to the next part of the presentation. Any more questions in the chat? Okay. So now I'd like to introduce Lizzie. So I think she's spoken quite a lot already, but I think she needs a formal introduction, and she's also going to provide us with more, important information. So Lizzie is the Statewide Coordinator, Victorian Disability Liaison Officer, Program Commissioning and System Improvement Division, Department of Health. We'll now be sharing information about the DLO program and how they can support people living with disabilities and their carers. Thank you, Lizzie.
Thank you for the introduction, and apologies. I'm not very good at sticking in my spot. I tend to jump in and answer questions. So I think Martin also gave a great introduction to the Disability Liaison Officer program, which I have the privilege of being a part of. I guess further information about the DLO program is, as I said, that the DLOs are based in health services right across Victoria. So we have DLOs in Southwest Health, all the way across to Gippsland, in Albury-Wodonga, or Wodonga-Albury as we call it as being Victorians, all the way down to Geelong as well. So we do have great statewide coverage. Our primary role is to support people with disabilities to access health needs or healthcare needs. So at the moment, obviously, there's a significant focus on getting people vaccinated, as well as helping people to get tested if required, if they're exposed to the coronavirus. So I guess as a group, we have helped to support close to 8,000 Victorians with disabilities and their carers to get vaccinated. And as I touched on before, we have quite a few tricks, I suppose, that we can help to meet an individual's needs, and to really make sure that the vaccination is as seamless as possible for them. So some of the things that the Disability Liaison Officers, or the DLOs, have done has been to help with pop-ups, as we call them, so vaccination within some of the special schools or at the schools. We've helped to organise in-home in-reach, where a team actually comes to your house or to the disability service and actually vaccinates people at home, so in a familiar environment. We've also helped people get into drive-through vaccination services, which has been really great for some people who may be comfortable in their cars but don't necessarily want to come into a vaccination hub. We've also got clinics that we call accessible clinics, where the vaccination appointments are longer, they're at quieter times. You'll stay with one staff member to walk you through the vaccination process, which for people who have concerns or difficulties in terms of going into a really busy or noisy or bright environment, can be a really good and safe alternative. We've also helped to get people who have needle phobias or a disability or an issue that requires them to have sedation. We've also helped them to get vaccinated as well. And I can see there's been a couple of comments in the chat about people we've helped to get vaccinated and with sedation. So I'm thrilled to see that we're already known and already being utilised by some in this group. That's fantastic. The Disability Liaison Officers help with the whole vaccination process. So not just there on the day getting the jab, but in terms of preparing someone for the vaccination experience. So we've partnered with Amaze, who many of you will know, the peak body for autism in Victoria. And as Mohamed popped up on the screen earlier, we've worked to produce social stories, which are a really good tool for people who really need to know what's going to happen in the appointment and have a lot of questions or concerns or uncertainties about the process. So we've worked to develop social stories or social scripts to step someone through the process, so they're familiar with what's going to be asked of them, what's going to be required of them on the day. All of these are done in reasonably easy English. So although they're not necessarily, some of them are translated into a lot of the key languages, they are in an easy English format. So they're appropriate for individuals who can read at about the grade 5-6 level. So this gives us increased ability for people to read them if they're not as familiar with English, or if they have a reduced reading age as an adult. It's worth noting we're doing a lot of preparation work at the moment for the 5 to 11-year-old age group. So at the moment, the 5 to 11-year-old vaccinations have not yet been approved in Australia, but we believe that they're coming. So we're working really hard with the state government and the health services to make sure we're aware of what the issues will be for the little ones who need our vaccination in this age group, and try to make sure that we're getting vaccination centres that are going to be really appropriate for them. So whether or that means a bigger booth so you can fit in, the child plus a pram, plus a sibling, plus mum or dad, or whether it means, making them a little bit more colourful, having frozen pictures on the wall instead of having just that cold clinical environment. We're thinking about it from that perspective, but also looking at what sorts of disabilities are more common in the 5 to 11-year-old age group. So thinking about what that might mean in terms of their needs. So, for example, often little ones might have a little bit of sedation or angel cream, as it's called, on their arm before they get a jab. So really trying to think about what are the potential barriers. What have we learnt so far through all of this process, and what can we apply to this 5 to 11-year-old cohort? I've probably spoken enough as I've been, jumping in through the session today, but I guess it's just worth noting if there are any questions or concerns about access to a vaccination, get in touch with our service. And when we say access, we don't just mean, physical access, can a wheelchair get into a building? We're really talking about true accessibility. So is information provided? Is there a consent form provided in easy English? Is there availability for an Auslan interpreter or another language interpreter on the day? Will it be quiet enough? Will it be cold? All of those sorts of potential issues that people with disabilities may face. So that's really it from me. I've popped the referral details in the chat already, but does anyone have any questions? Oh, that's easy.
Thanks, Lizzie. I have another question. Since you mentioned about easy language, when you go to get vaccinated, the forms they give you to sign in, it's scary. I had a friend who was going to get vaccinated, and when she read all what she need to approve of, she stopped and went back home. And most of the medical term, not everyone can understand. I know it's too late now in the procedure, everyone's vaccinated, but honestly, I believe most people signed it without understanding everything. This is what I believe. So just, Mohamed is laughing, just to let you know this. I don't know if someone else raised it.
No, that's really good feedback. Thank you. And it's, I'm not going to make an excuse for what's happened. I think it's a lot has happened in a very short period of time. And I think it's critical that we continue to make appropriate accommodations for everyone we're trying to reach. It is worth noting that the Commonwealth Government has recently, I think it was last week, released an easy read or easy English consent form, which is fantastic. I guess one of the things that should be hopefully easier for people to understand. The tricky thing about a medical procedure such as a vaccination is you do need to make sure you're letting people know about what the risks might be. And some of those have medical terms, and you need to use the medical term. But what the important piece is then having someone there to explain what the medical term actually means. So whether or not it's a form in another language or a form and a person to explain it, I think it's a combined approach. And it's certainly something that we've heard a couple of times, and we try and support. I guess one of the other things we've done quite often with people is we've given them the consent form or given them information about the vaccinations, knowing that they might need a bit more time to either understand it or process it or speak with their families about it. So if someone is interested in getting vaccinated and they're not yet, it's to provide them with that information and say, I'll call you back in a couple of days. Let me know if you've got any questions, or let me know if you're thinking about it, because for some people it is a more difficult decision to make for whatever reason, and we need to respect everyone's choices. Obviously, we'd like people to be getting vaccinated to protect themselves and to protect the community. But if someone needs a bit more time to process what's on a form or to think about it, we need to give them that time. And if they've got questions about the content of the form, we need to provide an opportunity for them to ask questions about that, whether or not that's with their GP or with someone else. We're happy to be guided on that. So I think with all of these things, the state government has done a great job of reaching the masses. And I guess the beauty of the DLO program is that we can really work more on that individual level. So sometimes it might take us a couple of days to organise the best way to get someone vaccinated. But that's more important to us to work at that individual level to make sure what we're doing is right for the individual. Because let's be honest, this isn't the only time in their life they're going to have a needle or a vaccination or engagement with the health service. So we want to make sure that that's set up positively, so that people come back and engage with, health measures in the future.
Just to add to what Lizzie said, I think it's important. If you are not sure, ask the questions. Never fear to ask the questions. I always tell people, never fear to ask any question. Every question is important because it's the concern that the person has, and you want to build up that confidence and assurance that what they're taking is safe and they understand. And again, as Lizzie said, it is important. It is part of the medical system to explain everything. When you go for surgery, they will tell you everything that has to be told, whether it be about the anesthetic, the side effects of the anesthetic, so it's the same way with the vaccination. You have to give all that information. Like, for example, Hayat, even if you go and buy antibiotic, if we all, when I teach, I've asked my students this question: how many of you have read that leaflet that comes with the antibiotic in so many, it's in different languages, but no one reads them because the doctor has prescribed it, we just take it, So I think the assurance is just ask, and even at the vaccination site, if you're not sure, ask, and there'll be someone who'll be able to explain and maybe give that simple version, which is important for people to get, I think.
Yeah, Mohammed, I agree with you, and but also you need to remember, like, the issue with people from CALD background. If they're getting vaccinated at the doctor's clinic, they trust their doctor. They will ask questions. But for example, if you're doing it in a pharmacy or in a vaccination hub, I don't think they will be asking questions. They will, like, due to many barriers you're aware of.
Yep.
So maybe, like Lizzie said, we take it on individual level, and we should do something about it.
Yeah. Certainly, and I think
more than a year now. The vaccine came a long time, like few months. I think this issue should be looked into.
Just with what everyone was sharing. Thank you, Hayat, for sharing that story. So it brought some of my experiences that I'm experiencing in my own Turkish community, similar to what she's saying, is that I feel like, I know that there was an instance towards the end of the lockdown, we had like the social bubble experience where two friends from different suburbs, they joined up and it was safe for them to meet. And I was thinking now, the department has the health champions. So, like, how can we utilize our health champions, the ones who, have that multicultural understanding? How can we utilize them in a good way where they could help the seniors, they can help people who have a disability around, sensory issue, autism, intellectual disability, all different forms of disability type, where they could, offer either like a phone kind of support or an online kind of support or something like that, where they can touch base, like something a bit more unique and creative. So that occurred to me, and I just thought I wanted to share that with everybody. And I wanted to thank Martin for sharing his lived experience. That was great. Thank you. And Dr. Mohamed Mohideen and Aurora and Lizzie and everyone else for participating, and Julie for bringing in her the carer group. But yeah, I think we need to come up with something different in order to support, support our multicultural communities from that disability lens. Yeah.
Thanks, Sarah. Thank you.
I think it's worth noting, Sarah, it's also, we're in a position now where, if there's a particular community group that, met on a Sunday afternoon or whatever it might be, where we know there's a group of people who are not vaccinated as yet, that have interest in getting vaccinated and, have community elders or people that they trust to be there, let us know, because we're very much at the point where we're looking at different in-reach options to really address groups that we may not have got to as yet. So if there is a particular group that meets on a particular day at a particular time, we can ask if a vaccinated can attend to try and work through a group at a particular time, organise the appropriate interpreters, etc. So I think at this point we've come so far as a state that we're really looking at what we can do to support individuals and groups. So just let us know.
And also we've got lots of clinical champions now from various CAL communities, and we have used them, I think, even to build up that confidence, because sometimes a person from the same community talking to them and explaining things is more effective. So we do have that we have a whole lot of CAL champions now with us, both clinical and faith and community leaders that we work with. And now, because we're out of lockdown, we can also go and do face-to-face sessions, which is the best way of getting the message across, I think.
Thank you, Mohamed and Lizzie, and thank you, Sarat and Hayat, for sharing those comments and concerns. There's another question. We have someone else who has their hand up here. Sultan, would you like to ask a question?
Hi, everyone. COVID will be with us for a long time. Therefore, I think it is very important to share all the knowledge, useful knowledge with the community, especially from the non-English speaking background, to help them to understand, to live safely in a COVID currency. Therefore, there are many tools in the communities, in some ethnic organization, many different groups in the local area. I think it will be good to reach those community, because each community has many different lives amongst themselves and they are diverse, to reach them and provide this kind of information. ECCV is doing really great job. Thank you, because we are getting all those information passing through our communities with our network, but also I believe there are many groups has been waiting to hear this kind of things, especially face-to-face information, very vital. And there are faith groups, there are social groups, there are educational group, youth group, seniors group, and somebody must reach to that group to provide information in their language in a culturally, linguistically sensitive manner. Thank you.
Thank you, Sultan. Thank you very much for that. Yes, and we are going forward with more engagement, because unfortunately we couldn't do that during the lockdown, but we are now starting to do a lot of face-to-face sessions. We're also going out into the rural areas to reach out to the CAL communities, because we know they're there. And as I said, the best way is the face-to-face. I think you cannot take that away from any other session that you can have, because you can then sit down even with a cup of tea and talk to people. And we then what we do is we normally take people from that particular community as well, and we sometimes have the doctors as well on board. We are not only now looking at vaccination, COVID vaccination, but we're also looking at other health aspects. It's the well-being of the person that we are very concerned. So moving forward, that's going to be the manner that these engagements will take place, not just on vaccines, not just on COVID, but looking at other health aspects and how best we can support the community going forward. Yeah.
Great. Thank you so much, Mohamed. I feel like that's really important. Did you have another question or comment, Sultan, or did you just,
No, I think everybody aware the importance of the reaching the community. My concern is there are many community members voluntarily doing lots of work, and they need maybe a little bit more encouragement and support to bring them together to reach the community, to educate them maybe in the beginning, and through them pass those right information to the right communities. And also, as a Turkish-speaking support workers, as a Turkish-speaking voluntary workers, maybe we can come together to develop some sort of strategy to reach the community from different level and pass through those information. Similar things can happen with other communities too, but support needed by the paid organization like Mohammed organizations and yours and other organization. My request is to get some support from there. Thank you.
Were there any other comments?
I have a comment.
Can I just respond to Sultan? Sorry, I had my mute. Just to comment on that, I think, Sultan, we've done a lot of training with community members. We have brought them on board. We have a program we call Train the Trainer, where we have Professor Margie Danchan, who is a world authority on vaccines, especially childhood vaccines. And we run these sessions. It's a 1.5-hour sessions we run in the community, where we have lots of community members coming, learning about vaccine, how to talk to the community, because even talking to the community is an art, because you need to be gentle, because people have fear. We are talking about something that is frightening. It's causing death in communities, causing a lot of harm as well. So we run these sessions, and we are very happy to train as many people. If you have people, we will take them to that training program. We then give them a lot of support as they go forward with lots of material that comes out from the department, all the latest news, because with the vaccine area, things are changing. Even for us, every day there's new, like the government also puts out new, like for example, quarantine change from 14 days to 10 days. So things have been changing as well. So we do this program with people, and if you have people in your community who would like to be trained, who then go out as vaccine champions into the community, we are there to support. We also have been funding a lot of various groups. The Multicultural Grants Program by the Multicultural Ministry supports a lot of organizations with running various programs and outreach programs in the community. There is a lot of support available. Maybe people need to tap into them as well, because the community leaders can tap into those and then support their own communities. Thanks.
Thanks.
Sorry, Hayat.
Yeah, Hayat, did you have?
No. Yeah, just a comment. First, I would like to thank you, Mohamed, Aurora, Lizzie, and the Department of Health for supporting ECCV throughout this journey, with providing the community with the right information around COVID and the vaccine. I'm happy to hear that you're going to engage with community people face to face, because with our work, we found out the seniors and newly emerging communities, like for example Afghan and Burmese, they missed out on many information because of digital literacy. They couldn't. We tried hard to get them to attend, but they couldn't. So this is, I think, if you concentrate a little bit on seniors, I'm not telling you, I know you know what to do, but sharing our experience as community workers.
Thank you. Thanks.
Thanks, Hayat. That's a good point and a really important comment. Does anyone else have any comments or questions before we wrap up? No? Okay, I want to thank everyone for attending. I want to thank Mohamed and Aurora, Lizzie, as well as Julie and Sarat, everyone involved for helping us organize this great session. And if there's no further comments or questions, and I also want to say a big thank you for Martin for presenting and telling his story as well. So if there's no further comments or questions, I might just wrap up the session there.